Elliot, welcome back to this side of the pond.
Yeah, thanks for having me, Joe. Great to be back.
Yeah, and you've had quite a week. You got here on Tuesday, right after our magical 4th of July, and sorry about the liberation from the UK, but hey, things happen. But you've been busy in the office all week.
Yeah, absolutely. Yeah, it's been a great week. Working here with Ryan, starting to build out our US commercial team, so first boots on the ground here in the US. And it's been great to be able to come and station ourselves down here in Delray and have the support of yourself and the rest of the team.
Yeah, Ryan, you've been keeping him super busy.
Yes.
With really strong individuals who want to get a shot at working with Enovis.
Yeah, I think we've got, 6 people in, and you're going to have to find a way to hire all 6. Because they're so closely, I mean, it's going to be tough.
Yeah, and this is a really interesting point because look, we've built commercial teams in the UK. We've been running a business for 10 years in the United Kingdom. So we've gone through that process of okay, how do we go about finding the right talent in our home market? But we're very well aware that just because we speak the same language doesn't mean that the markets are exactly the same. So we don't know what we don't know, and that was one of the big drivers for us to come to you guys and say, look, this is what our plan is. This is what we think will work. This is how we think we'll be able to find these people. These are the people we could find. Who are you going to be able to find that we can't? And every single one of those 6 we couldn't have found.
And when you and I first chatted, and for our audience, share a little bit about Enovis, the organization's product platform, its mission, et cetera.
Sure, thanks, Joe. So the business has a very clearly stated mission, and that's to become the world's partner for surgical training technology. So what does that look like? Well, we design and manufacture surgical training technologies. And when we think about surgical training, there's a really big continuum. Okay, so there's very early stage, which is, and I think the hot topic of robotic surgery is a good way to describe this, which is early stage, understanding what is this piece of technology here that I could use to do surgery? How do I set it up? How would I go about handling it and using it? Then there's a really big chunk in the middle, which is where Enovis primarily sit and where we focus, which is the simulation-based learning. So learning away from the patient bedside, using simulation technologies, and we take a slightly contrarian approach to the type of technology we build, and allowing surgeons to understand how do I do the procedure, how do I do the procedure with this particular device, and then gain feedback on that. So we use a combination of augmented reality, computer vision on our effectively our digital learning platform that sits in simulation. And then the other bit of that continuum is the bit that goes into theatre. So that's where the likes of Proximie or these other telemedicine and telehealth companies come in, where they allow that training and that proctorship to continue once you've gone beyond the simulation space. So we sit in that big chunk in the middle and do things slightly differently to others.
And you, co-founder, also a surgeon.
Yep.
Right. So it's fun to have, and this is what I like. We always chuckle about this. You're a startup that actually makes money.
Who knew that rare thing, a different type of unicorn.
But that actually upset some of the VCs who wanted to invest in you, didn't it?
It made it interesting for them because it's that land on the water, looks like a duck, quack like a duck, then you're a duck. Well, look, we're very much a duck. We've built a deep tech platform. We describe it as a scalable modular infrastructure. So we have augmented reality, computer vision, we have machine learning algorithms, we have all those buzzwords where if we were burning through loads and loads of cash and only talking about that and actually struggling to get people to adopt it and use it in the early stage because we're not quite sure where it fits, then the VCs probably would have said, here's $100 million, that sounds great, off you go, because that's the norm. We've taken this contrarian approach, which is we're going to start at the bottom of our part of the continuum. So I mentioned there's this continuum of sort of pre-learning, the simulation-based, and the intraoperative stuff. Within the simulation-based, there's a whole continuum there as well. So you have low, medium, high fidelity. We started at the bottom with basic technologies and hardware and became a hardware manufacturer. And then we've built our technology stack over the top of that. So the buzzword we use is Internet of Medical Things. It's digitalizing hardware. And because we went on that journey, we were able to sell hardware that has intrinsic value and use that to grow ourselves, which has meant we haven't had to dilute very much along the way, which is nice.
That's valuable. As the owner. And I heard a term this past week at the SRS show in Orlando that Patel put on for the training in the category you're in, wisdom as a service. And I thought that was brilliant. wisdom as a service for the learning, simulation, training side of things. So when we did the intake call, and this is, the reason why I thought this was a valuable piece for the ecosystem was we have a number of clients out of the UK that we've built their sales team. We're working with Quanta, Proximy, Novus, and the same with Israelis. We have a lot of Israeli partners. So you had reached out to us, and you and I had become friends and partners earlier than when you called us for the sales, and we got on the phone call. And Ryan and I got on the phone call, and it was great to have Ryan in there because he ran sales teams, ran sales organizations. And we had to readjust quickly on what you thought you could put on the street here in the US. Tell me about that.
Yeah, it's so interesting. It goes back to that point of you don't know what you don't know, do you? And this is where we really value partnership in all parts of our business. So right now we're talking about building a team. So who are our partners for that? And I mean, I've been following you for probably 3 years before plucked up the courage to reach out, and as you say, built a friendship, which is really nice. And that's a really important part of partnership for us, is do we get on with the people we're working with? And then the next piece was, well, this is our reality of the cost to put someone on the ground in the UK or Europe. And this is the profile of individual that we're looking at. And again, it's that question of, let's ask questions that we don't know the answers to and rely on our partners and experts to answer that. And yeah, it turned out that there's some interesting profiles that you guys have put in front of us where we go, okay, that's something that can really work for us. And again, just while we're on it, to your point of having Ryan there, which is, I think this is really interesting. Ryan's background, I'll let you speak to it, but in medtech has been hugely valuable to us because we've been leaning on Ryan's experience. Yes, I've been building a business for 10 years in the UK. Ryan's been in this space for double that amount of time. So that's been super useful to us in terms of finding the right people.
And Ryan, you sat in the initial intake call on this, and now you've been on the journey with Novus and Elliot and putting people in front of him. What were some of the unique things, and what were some of the experiences you had from the early stages of your career as you listened to their need all the way through your growth to executive level, and then now with our firm?
Yeah, well, first of all, Elliot's got 3 core values, and that makes it easy to figure out what type of person's going to fit with his organization. So it's work ethic, it's attitude, it's excellence, right? And when I think about that, I think about what organizations have great training, great cultures. Well, I was lucky enough to start at one of those organizations. We spoke about this before. It was a company called Cintas. Great training, incredible culture. When you get there, they give you a book called The Cintas Way, and you read a book about the company. And so we looked at candidates from companies like that, ADP, Black & Decker, DeWalt, all great training programs, enterprise, but we also looked at traditional medtech companies too. And we thought, let's get a mix of these people in there, put them in front of Elliot, and see what he thinks. And I mean, we had an incredible mix. I mean, we had well over 500 applicants for the territory manager positions. And when you have to narrow down 500 people to 3, and we have 6 in over the next couple weeks here, it's been a monumental task. And we also needed to do it so that it fit your core values. Yeah. Right? So I feel like we're off to a great start. I mean, we're almost closing down the first portion here, and I'm excited to see what's next.
Yeah, so am I. And I think to Ryan's point yesterday, at the close of play yesterday, it was, you're going to need to go and find some more money because all of these guys are amazing. And I'm sitting there in the interviews going, I completely agree with you. And I think just on this point, one of those is, yeah, we've got our core values driving, and it makes it really easy to communicate what you're looking for, and it makes it really easy to understand, is this person going to fit? But that's at a macro level. What else have we got to help us find those right people? And again, systems and process. So 10-year-old startup. We have the agility of a startup still, building our first business in the US, but we've got the systems and process in place from a company that's been going for a while. So one of those is things like the Belbin profiling, which we like to use. Understanding, is this person going to enjoy doing this role from the way in which they are wired? And that's something that we've lent on over the last few years. And I know within your organization you use the same. And I think that's something that's been really helpful, along with, here's your core values. Someone at a macro level going to fit with those. Now let's get down into the nitty gritty and understand with the process, are they really going to be able to thrive in this role? Yeah,
and that comes down to, and Ryan, your thoughts on this, it comes down to, what is the carbon base of the individual? I don't care if you sold a scope. I don't care if you sold a trainer. I care, we look at intelligence, curiosity, what I call conscientiousness, which is diligence, discipline, organizational skills. And then, of course, IQ, because you can't fix dumb and you can't fix lazy, right? No matter how hard you try.
Right.
And selling the platform that you're selling, it's a sophisticated platform. However, you've been visionary enough to realize this person does not have to come out of medtech. In fact, I may not want them out of medtech. I may want these core skills because your training program is very, very good.
Yeah, and that's something we pride ourselves on, and we work really hard at, and we're always looking to improve that. So to that point, it's has this business got these three core values, which had nothing to do with understanding the space or the technology they're selling. It's basically, have they got the ability to learn those things, and if they do, and the attitude to then deploy it, we will teach them everything else they need to do. And this is just, again, something we've learned from our experience in the UK. I'm sure I won't name him. I'm sure he won't mind me using his profile. One of our biggest producers in our UK team was a personal trainer, but he came into our process with a great Belbin fit. He lit the room on fire when he came in throughout the whole process, and we have a 3-stage process, and he completely fit attitude, excellence, and ethic. And we asked ourselves at the end, can we train this guy to understand the words so that he can provide value to the surgeons that he's dealing with? Yes, because he was super interested in anatomy, physiology, really interested in the space from his personal training and sporting background. And then the next thing was, can we train him about the technology? Will he have an ability to talk about hardware, then software, which almost is often sort of is acting as a SaaS model, the platform we're selling? And the answer was yes, and we put him through our initial 2-week immersion course, which everyone comes to our headquarters to do. So it's 2 weeks of immersion with myself and now the rest of the team. And then it's in-field training as well, because I think even if you find the most talented people with the best attitude and all these other things, you've still got to coach them, you've still got to support them. And it's the same with elite athletes. Like, they're incredibly talented people, but they still need a great team around them who are actually getting stuck in and continuously giving them support to grow.
That's right. You've led many sales teams and hired many salespeople. Now we're fortunate enough to have you leading our commercial initiative as we have other clients come to us and build out sales organizations, or even VPs of sales and marketing, which you're working on now. As you put on your leadership hat and you put on your medtech leadership hat and building teams, what are the things that you would give as guidance to organizations when they're looking for those entry-level, even mid-career people when selecting talent?
Yeah, that's a great question. I would definitely be open to different backgrounds, and I think that is what has helped Elliot so much. Sometimes we get very siloed in what we want to accept based on somebody's resume or their experiences, but what leadership qualities do they have outside of that? What are some of the skills or hobbies they have that speak to what this role needs? And I think that's what Elliot's done well. In fact, he mentions these Belbin assessments. We've taken strength finders, disc profiles, all these things in corporate America, and they rarely get used. And he's actually using it in the interview process as a way to differentiate each candidate. And then these individuals, once they get hired, that's going to be part of their development. So in talking to people, you find out what they're missing most is development in their career. They want someone to invest in them and have succession planning, not this, once a year check the box performance review. You and I, we meet on a weekly basis, right? I know where my career is going because we talk about it every single week. And Elliot, you have the same mindset. And I think those sorts of leadership qualities from the top trickle down and spread out through an organization, and it feels more flat and less hierarchy. And so to me, it's being open to having those conversations and letting people know that this is where we think you're at, this is where we think you can be, and hire for that, not just what the CV says, not just what their latest resume update says.
I would agree with that. You and I were chatting about partnerships. I want to jump onto the subject of partnerships for a while, and because they're special to us. And we've, in our firm over my 3 decades, I've got lifelong friends that have been developed through this business and still can run side by side. And it makes things easier, I believe. Some people get caught in a complex and mistake business and friendship and can't manage both.
Yeah.
It's really odd. I don't know why it's such a problem, but people have that problem. So tell me about your thoughts on your partnerships as you come to the U.S. and the partnerships you've formed here.
Yeah, I'm gonna start with ours because I think partnership isn't. I think a lot of people, when they hear partnership, they'll think, okay, who are you gonna merge with, or who are you partnering with on a technology standpoint? some people would probably look at this and go, this is a provider-client relationship. No, this is a partnership. So let's start with that one. We're down here being able to utilize the resources that you have in your offices, allowing us the space and the time and the expertise. So I have to comment on this. There are very few search firms that we've worked with that would have the expertise like Ryan and say, you can have him for 2 weeks with your interviewing because we've said we think that's going to add value. So that is, I mean, that's partnership in a nutshell. But then there's partnership that goes on through the rest of the industry. So back into that more sort of, are we partnering on a technology standpoint? And this is getting really, really exciting right now with the explosion of the robotic surgery and digital surgery spaces. There is a lot to do. There is a lot we can do as an industry to work together in partnership to make sure that we're having best outcomes for the patients. Because there is so much to do in terms of the hardware technologies, the digital space, I don't think any one company or even 1 or 2 companies, A, are going to be able to raise enough capital on their own to do that, and B, they're not going to be able to do it on their own because focus is key, ultimately. So the way we view partnership from a technology standpoint and an industry standpoint is, well, going back to our continuum, we sit in this piece of the continuum here. One of the things we have, which we are incredibly bullish on, is focus. We're not going to get dragged into this bit at the bottom. We're not going to get dragged into this bit here because there's other people doing that really well. But to make sure that there's the proper impact on patient care and the ability for physicians to take care of patients really well, you're going to need to make sure that that's all joined up. And that's where we start to look at saying, how can we do that through partnership? And instead of viewing someone as going, well, that person's a competitor over there, it's like, no, that person's adding value because they're solving problems in the bit that we don't have the bandwidth or the resource or the things, we don't want to go and solve that. But these guys will. Let us solve this bit, and let's see how then we can join the two together.
Complementary.
Absolutely.
Yeah, and I love the leadership that keeps that open aperture as they look at the playing field. There's just too many times, as you said, that person is a competitor. Well, not really. When you boil it down, they're really not. And it's not a zero-sum game in this business either, and especially in the aspect you're in. You know, over the last few months that you and I have got to spend a lot of time together, in person especially, we've been at LSI together, we've been at SDTS together, and I've watched these great friendships form and business alliances form with, like, Brian Lord out of Pristine, Nadine Hashash Haram out of Proximy, right? Burke Toss. And it's fun because I get a chance to introduce y'all, and then you go, and I'm always excited because our mission is to hold this industry up or prop it up, not make money out of it. Mm-hmm. That'll be a byproduct of doing the right thing all the time. Mm-hmm. And I've watched that. And so they've opened their doors and their kimono to you, and you and I were chatting is, eventually they're going to come to the UK and ask for the favor in return.
And this, I think this idea of, first of all, the point you make on your mission, you stick to your mission with absolute focus, that the money piece will come. Mm-hmm. So we look at the same, like our mission, become the world's partner for surgical training technology. We know that the business will be successful if we deliver on our mission. Mm-hmm. How are we going to deliver on our mission? We're not going to do it on our own. Yeah, you mentioned Brian there. I've picked up the phone a number of times to Brian to say, look, Brian, that you've been in this space for a long time in this country. Here is my understanding of how this thing works here in the UK. Mm-hmm. And he'll just be so candid and honest with his time. But I know there is going to be a time when Pristine are going to want to build a commercial team in the UK, and he gets to pick the phone up to me. And I think that is brilliant. And that's something we've experienced in the last sort of 18 months or 2 years where we've been really starting to ramp up over here in the US. I think it's pretty unique to the industry. I don't think you see that very often. I think it's unique to the segment of the industry that we sit in, these startup, scale-up businesses that are looking at it with that really wide-angle lens, as you say, to say, okay, instead of just sitting in silos, how can we work together so that we can all achieve great things?
And some of that comes from the people you run with, right? So I know that when I get introduced to somebody by somebody else, like as an example, Scott Hunnekens is a great mentor of mine, and Scott and I have worked together building Verb and with J&J and Google and many things after that. But when Scott puts me into that ecosystem, I then return that favor in kind as often as I can. Mm-hmm. So I think it's also, and you pointed out Brian and Nadine and Burke and those others, that's how they roll. Yeah. And like people find like people in that approach to running their business.
Yeah. It comes back to this sort of coaching mentality and leadership. It's not what can you do for me, it's what can I do for you, because that actually is something that you gain pleasure and enjoyment from by providing value to other people. So yeah, I think it's really refreshing when you then have other leaders that are open-minded to do that, because I think it's difficult. It takes to the point of IQ, it takes an incredibly high EQ for people to be able to put especially competitive people who are like, I want to go and win and do really well, to put some of those things aside and say, okay, I can still do that, but I can do that in a controlled way, and I don't have to fight everyone. Actually, I can partner with people.
That's right. And I find these people that I've been mentioning this and mentioning that you also roll with and you roll with, is we all have these enormous egos, but we also have them balanced with humility. And I think that's what great leaders have. You have to have an enormous ego. And you have to have the capacity. Otherwise, it's just me, take, mine. But when you start to actually overload it with humility and still have this power, that's where I think everybody benefits.
I'm so glad you raised the ego, because there's two types. There's a strong ego, which is a strong ego is that ability to say, I'm confident, I've got the ability to push forward because I need that resilience and strength and confidence to do these big things and make big moves. But that strong ego also allows you to have the humility. It's a fragile ego, which is the dangerous one, which is I'm actually sort of acting out these things over here, but I don't actually believe it myself internally, and so it's really fragile and it gets fractured. And the minute that then it gets fractured, I'm no longer listening to anyone, and I can't engage in these things. So I think that I'm really glad you raised that, because people often, I think, associate the word ego with a negative connotation. Actually, a strong ego is a really positive thing.
And then as we go out, Ryan, you've had a chance now to run this sales project and the build with Elliot and the team. What has been the big aha moment for you, and the message maybe to people who are just wanting to get into medtech or early in their medtech career as salespeople? What guidance could you give to them?
First, I think you need to look at the story of the company that's reaching out to you. I've had a lot of people that I speak to about a startup like Elliot or others, and they immediately want to go to the compensation portion. And what they need to realize is this is your chance to work with somebody that's building something, and that's a gap on your resume that you could fill in no other way. So if compensation's the only thing you're worried about, you're probably going to miss on a lot of incredible opportunities. And that's what I've realized through working with Elliot is, we've got a surgeon here that saw a gap. He saw a need. Right? And he filled it. He said, the way that training happens now is good, but it can be great. And how can we make it better? And he and Jordan created this incredible, you said your whole business was built on your Pyxis Pro Move, right?
Yeah.
Your first model, basically.
Analog box trainer, but we made it more affordable, more accessible, more functional than the competition.
And now look where you've gone.
Yeah.
Right?
We
So
built
analog
a factory
to digital, it's just an amazing story. So my advice to people is really don't just look at the compensation. Look at the whole story and say, how can I be part of that story? And like we say all the time at TMG, who will I become working there? And if I do bet my career on this company, where could my career go? Or am I just going to stay where I'm at and wait for somebody to get promoted or retire so that I can move into the title that I want? Don't be a title, be a contributor. Don't be a spectator, be a participator. And that's what you get in this startup environment. And that's why I love working with people like Elliot, because I feel like I'm part of the team. Just like when I was a med device rep, I felt like I was an extension of the lab, right? Providing value and procedures. Now I get to provide value as a hiring manager, which I've done for years, and I get to do it arm in arm with the CEO of an amazing company. So that would be my advice.
And then Elliot, what have been the big surprises before you stepped over here to our side? What did you expect that didn't happen, and what did you have no idea was going to happen that happened?
I didn't quite. I think I really underestimated the way in which compensation packages are structured. It's not necessarily the size of them versus the UK, but just the structure of things in the US. That's been a really big learning curve for us, and the ability to learn in that scenario is it all comes back to focus and planning, because we have really well thought out, really detailed plan of what's our budget to address the US market, how are we going to go and do that. But what we also put in our plan is a lot of contingency, because if we had come to the US and gone, this is the exact amount of money we have to address this market. Oh, we've just found out actually that we can't afford the people that we want. We can't do anything then. So I think that was a big learning curve for us was how are we structuring compensations, and can we then fit that into the budget? And that's been, again, the help that Ryan, yourself, a lot of that early learning was good, because I was picking the phone up to you, Joe, saying, is this going to work? And you just said, no, you need to go and do this. And again, the rate at which we can learn from that is phenomenal. I think one of the interesting bits for us is that it would appear, because we didn't know if our hiring process, so we like to do some paperwork, Belbin, some other capability screening stuff, then we go telephone interview, then we go face-to-face. That's worked really well for us in the UK. We didn't know if that process would work, but so far, I'm really pleased to see that seems to be working really well for us, and actually seems to fit with the US mentality of we want to move quickly here. Mm-hmm. We want to bring people in that are going to move our business forward quickly, right? Yep. And instead of having 4 or 5 stages to each, here's 4 telephone interviews, speak to 4 different people, nice. Here's 4 face-to-face, we like to go pretty quickly, and that seems to have fit really well, which is really encouraging.
Yeah, it's important in this market, any market. You can go quick, but you still have to be precise, diligent, and non-negotiable in what you want. And yeah. Too many times people assign diligence and accuracy and sort of the ability to sell your opportunity, meaning it takes a lot of time. It doesn't. No. It doesn't. You can't rush the hiring process, because there's nothing worse than having a bad hire, finding out 5 months later, especially in a sales role, and then the remediation involved with that, and then the esprit de corps on a small team. Yeah. It's incredibly important that you realize that you're hiring almost 20% of your overall company and maybe 100% of your US company. Yeah, you've got to get it right.
Absolutely. And you use this term a lot, and I think you've heard me say this a lot, is patient urgency. Mm-hmm. So structure, focus, have a really good plan, don't rush it, but then deliver everything that you need to with that urgent, with that speed when you're in there. And you're talking about that touched on that point there, Joe, which is when you're selling the opportunity, and you mentioned it, Ryan, we're quite honest with a lot of people that come into our interview process and say, you could probably go and earn more money in one of the big med techs. Mm-hmm. But here are the other things that we see as value adds. And if they see them as value adds, they're going to be the right fit for us. And we find that's a really big part of that process, where we can take people out of the process pretty quickly, because they go, I only want to earn loads of money, and which is great. Mm-hmm. If that's what motivates you, that's absolutely fine. But you can do that somewhere else and do it better, which will be good for you. So,
agreed. Yeah. It's a good place for us to stop. Right, thanks. Elliot, always appreciate it.
Yeah, thanks for having us again. Lovely to see you both.
Always. Let's see if next week brings you your own next week too. So
yeah, absolutely.
We'll take you out and get more Wagyu at the Grove, by the way.
Perfect.
I'm Joe Mullings from 160 Studios. Be well.